Hello, my name is Jory. I'm a co-founder of MyBreath, along with Olga and Joachim. At MyBreath, we improve people's living by self-management of COPD using a mobile health.
Okay, so I'm going to talk a little bit about COPD. I know that we already talked about the subject, but just a brief. Okay, so COPD is a very common disease. It's characterized by airway inflammation. It's a chronic disease, and the most important thing about COPD is that it has exacerbation. Most of the people will have exacerbation, and it has many comorbidities. So what a patient that has signs of COPD are undergo. First thing, they will have 3 symptoms, which is cough, sputum, and dyspnea. So patient has a first symptom onset. They will go to their healthcare provider, general physician. That physician will refer this patient to the hospital, to the ER. And if this patient is lucky, he will be properly diagnosed with COPD. So after he will be diagnosed with COPD, he will get medications, and he will be told to stop smoking and to exercise and do many things, but he might be not compliant to that. And so he can get exacerbation, and by exacerbation, even the slightest common cold that we get in the winter can lead to COPD exacerbation. So we want to tackle this vicious cycle. We want to solve patient compliance to the treatment and to the to the advisement for a lifestyle. We want to reduce the high readmission rate and to reduce the load in the hospitals. We want to have a prediction of the deterioration. In medicine, we established many factors that can predict deterioration in COPD patients. They are clinical based. They are all been trialed, and we will talk about it in the next slide. And also, we want to have a better management for these patients that usually come from a but a poor background, low social economic state, but not always, but I mean the majority from what I've seen in the hospital. And we can also reduce by reducing the hospitalization, we can reduce related hospitalization, infection, and complication. So I want to talk a little bit about the market. So in the US, there are 12.7 million COPD patients. It's the 3rd leading cause of death in the US. It costs $50 billion in the US. And more than 50% of the patients are readmitted to the hospital within 12 months after the diagnosis. So let's talk about our solution.
So what we suggest is to build a mobile health-based platform that will allow patients to self-manage their condition by recording a number of parameters. We'll elaborate on that in a minute, and follow up on their health while keeping in touch with their healthcare provider. So that's kind of the generic picture of the system, where patients are given a mobile health device with some sensors. They record their physiological data on a weekly basis, which they upload it to the cloud server, to the MyBreath cloud server, where the data are stored and accessible by the patient and their healthcare professional at the end of here. So there are a number of parameters that that are meaningful to record using sensors like this phone pulse oximeter that you can easily buy online to date. So we wouldn't be using this one because we want to stay medical, so it has to be a CE or FDA marked device. But these are now available, cheap enough to allow to to give that to a patient on an individual basis. So recording a number of parameters, heart rate, breathing rate, oxygen saturation. So for example, can be these three parameters can be derived from the pulse oximeter, a number of questionnaires as well, standard questionnaire in the practice of COPD, and send that on a weekly basis to our database. That would allow to record and follow up on patients for their benefit over time. And in, say, the end goal of what we're doing would be to elaborate, use this data to build some machine learning algorithm that would identify potential events before they happen. So trend into the data, into this time series before a readmission event happen. So that's an example. That's a very, again, generic example of how this kind of machine learning algorithms are built using different features, which are the data we send to the cloud, time series, and a predictor of whether or not the patient is at risk of being readmitted or is in the safe space of his physiological parameter.
Our business model. Our potential clients are insurance companies and healthcare providers. We will send our product, license per user, rather than medical devices that cost between $100 to $200. Our competitors, LifeMap, they provide self-management platform for monitoring COPD, and they provide sensors that can be suitable for smartwatches or inhalers in order to track and monitor the patient's conditions. Our IP. We record relevant biosignals using medical devices, and we predict and we have a predictive model for exacerbation. Our next steps. First, we'll do market research. We will interview physicians and patients. Then we will record data. We will do that in order to assemble the most suitable machine learning algorithm for our patients. We would like to thank Vitaly Sitora and his team for organizing the event, and Dr. Rami Fisher, you can raise your hand, for helping us. MyBreath, improving the quality of life of patients with COPD.